morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
You hear about somebody you know that has had a heart attack. The person that comes into your mind is probably a male that has had a heart attack. You know, a lot of times we don't consider the women in our lives and the people we care about having heart attacks, and that's kind of what we're going to be getting into today here on the Health Talk program on WAJR. I'm Jim Stallings along with Kay Murray. Good morning, Kay.
Good morning, Jim, and those numbers are up, I believe, for women, so we can talk about that too.
With us in the studio today is Dr. Dave Lawrence, Medical Director of the Mon General Emergency Department. Good morning.
Good morning.
And also we have Nancy Ord, and she is Director of the Emergency Department at Mon General Hospital. Good morning, Nancy.
Good morning. Happy Valentine's Day.
And happy Valentine's Day to you. Look who's wearing pink today, or is that red for Valentine's Day?
It's pink.
Oh, okay. People thought I was talking to Nancy.
I like the tie myself with all the little hearts on it.
I do, too. Oh, right. So, Nancy, I want to talk to you. Why do we always think of a heart attack as being associated with a man as a woman?
Well, because women experience different symptoms, and many times they don't report their symptoms or seek help as quickly as men do.
We've talked about men's symptoms before. I think uncomfortable tightness in the chest, pain shooting down an arm, something like that. Is that different than what women experience?
Sometimes they get an indigestion-type feeling, discomfort that goes into their back. Doesn't really stop them because, you know, the old adage, a man may work from sun to sun, but a woman's work is never done.
I know that one.
Yeah, I thought you might.
I'm the only one responding to that. You notice, Nancy?
Yeah. So they get it's called atypical symptoms that they have.
And do women identify that they're having a heart attack or having a problem, or is it usually something else that they think about?
Most times not. They present after the heart attack when the damage has been done, and that's why it's so important for them to recognize the symptoms and seek help.
All right. So, again, there's the feeling of it's not really in the chest. You said it's more of in the stomach area?
Well, a lower chest type, into the back type feeling. It could go up into their jaw, down their arm. They get very, very hot, sweaty, and sometimes people think, I'm having a hot flash, I'll just go on with my day and forget about it. And then they come in because they're so short of breath they can't do their daily work, and we find out they've had a heart attack, the damage is done, and now they have very little pumping function in their heart. We've
talked about stroke, people who are experiencing stroke symptoms, how important it is to get them quickly to the hospital and medical treatment. And if a woman or a man is having these symptoms of a heart attack, is time critical as far as getting them care?
One of the most important things. We are looking at our chest pain center designation, and one of the things that we found in looking at our data is that better than 54% of our folks that come to us present greater than 2 hours after the symptoms started. And it's so important. That first 2 hours are so critical.
But Dr. Lawrence, as we know, some women could go on for maybe a month and just ignore some of these signs.
That's correct. And some of the women's symptoms can happen in men as well, but are so vague that it does take a heightened awareness to recognize it. Hallmark of most cardiac disease is that it will exacerbate or get worse with exertion. So the subtleties that you may find are that your exercise tolerance has just decreased, or that after you put in a day of work that you have done for years and years and years,
so
now you're completely fatigued and completely worn out and have no explanation. So if those symptoms occur, conversation with your family physician about possibly stress testing and seeing if there's something going on there. If you experience that as a sudden onset kind of thing, what Nancy was saying, time is of the essence, to report to the emergency department where we can take immediate action and prevent the damage.
So women, really the signs are not as predictable as men.
That's correct. And the age group, also to what Nancy spoke, when you go perimenopausal, some symptoms come around, and the females tend to think, oh, this is just a change of life. It's probably just part and parcel of what I'm supposed to be doing. And that's the age where the risk factor for women actually start to equate to the same risk factors as men.
Yeah, and I look at all these symptoms and I think, wow, it does, because I've been through that experience, and I see sleep is a problem if you're having some heart problems. Anxiety, all those things do build up to a woman over 55 to 60 that could think we're just going through menopause.
That's correct. I think that some of the focus needs to be early recognition, but knowing what your genetic predisposition to having problems is just as important. There's some modifiable risk factors, and there's some innate risk factors that you can't do anything about. So if you're having those symptoms and you know that you have a family history of premature coronary disease, you need to be very aware of it. If you're overweight, if you're diabetic, have high blood pressure, you can always, if you're a smoker, that's a risk factor in and of itself. So all of medicine is a math equation essentially, and this is knowing whether or not you're at risk for that. And that's what we're basically doing today, is to try to tell you how to recognize it and how to modify your risk factors.
Our number is 304-296-0041. Dr. Dave Lawrence is in, and also Nancy Ord. She's director of the emergency department at Mon General Hospital. We'll take a break and be right back.
This is Mon General's Health Talk. If you have a health-related question, call us now at 304-296-0041.
We're talking about women's health this morning, and really focusing in on women's hearts. And we are more or just as apt to have heart attacks as men. In the studio today, we have Dr. Dave Lawrence, medical director of the Mon General Emergency Department, Nancy Ord, director of the Emergency Department. And let's focus in on signs, Dr. Lawrence, if we could, and break it down for us as far as prevention, lifestyle, and all of that.
Okay.
Prevention first.
Prevention would be, there's some things that you know you can alter as opposed to those that you can't. You can't decide who your parents were going to be. So if there's a genetic predisposition, there's not much you can do about that other than be aware.
Meaning if our mother or father died of a heart attack, or if our mother, for the women, is that going to be more or could it be your father as well?
It could be either way. It would be, for women to women, it would be more premature coronary disease in women would be more important to know in your family, although any heart disease in your family would be important to know. Then you need to know that everybody needs to know that there's modifiable risk factors, things that we can all do. A healthy diet, decreasing cholesterol and fat intake, regular exercise program, non-smoking, weight under control, and if you have medical problems that need to be medicated and they need to be monitored. Some people are going to be hypertensive or high blood pressure no matter what they do. They need to have a constant relationship with their primary care physician to make sure that that's under control. People will be diabetic either by genetics or by lifestyle, and they need to know that keeping their diabetes in good check is also very important.
I want to get into a little bit more of the symptoms, is why I introduced that to you, because we've talked about fatigue, we've talked about shortness of breath, we've talked about the anxiety, and Nancy, you just touched on it. It's the stomach. Talk about how we're going to know, is this an indigestion problem that we're going to feel, or what do you mean by problems with the stomach?
It can be a type of indigestion, but it can also just be a full feeling, like you can't get a good deep breath, just kind of annoying heaviness type feeling right there that you can't get rid of, and you can eat all the Tums you want and nothing stops it.
And does age play a part in this, Dr. Lawrence, at all?
It does. Usually the recognized ages that are probably going to be modified are age 55 for a male, or 50 for a male, and 45 for a male and 50 to 55 for a female. I think that that's tradition, and and that has to do with the estrogens and the female hormones are somewhat protective about increasing cholesterol and plaque for a while. I think research is probably going to, just because the sooner that you take care of things, the better. I think we're probably going to amend those numbers downward.
And speaking of research, and we have information here about a study of 515 women. 95% said they knew their symptoms were new or different, but 48% of them reported sleep disturbance. And I think sleep disturbance probably can be attributed to a lot of different things, but you wouldn't think about that being associated with a heart attack.
Which is why we talk about menopause, because you go through that with menopause as well.
Also, a shortness of breath, indigestion, as we mentioned, and anxiety. 35% reported increased anxiety. So these women, 35% of them knew that I'm not usually anxious. I don't usually have anxiety. And so they noticed a change that led to perhaps being diagnosed with a heart problem.
Well, a lot of times what can happen at night is if you've had a heart attack and your heart's not pumping well, when you're doing other things, it's really, really hard for your heart to keep up. So at night when you lay down, you get short of breath. But the other thing that happens is your heart's not focusing on everything else, so it finally starts to help get rid of the fluid in your body. So you get up and go to the bathroom a lot at night. And that's one of the things that people find.
Yeah.
And in association with the symptoms also for menopause, I mean, there's hot flashes, sweats, and those types of things as well, also associated with a heart attack?
Absolutely. Absolutely. It's some of those atypical presentations that women just think that, oh, this is just part of life and this is what I have to live with. And
the age plays into all of that as well. That's interesting. There's going to be a health fair coming up on the 22nd and 23rd, Mon General's Health Fair, and I know that you've already had several people sign up for the multiphasic blood analysis. What did you say, Greg, over 1,400 at this time?
Yeah, it's getting to be a lot already, so people know about the health fair and they're getting signed up for it quickly.
So what with the health fair can we get involved in for women with their heart?
Well, we have the multiphasic, and that actually looks at your cholesterol, your good cholesterol, your bad cholesterol, your total cholesterol, and it looks at the ratio of good to bad, which is very important too. We have blood pressure screenings. We have heart wellness checks. We have echocardiograms, EKGs. All those things are out there at minimal to no cost.
Yeah, I was going to say, do you have to sign up for any of these things? And if we come out, how should we be dressed?
Watch in the newspaper. They will have sign-up times, and dress comfortably so that, if you need to remove your blouse for the procedure, that they can do that.
Okay, take advantage of it. How many days? What's the times of this, Nancy?
Friday, it is 7 a.m. to 5 p.m., and on Saturday, it's 7 to 3.
Okay, and the multiphasic, is it too late to sign up? Since Greg's just telling us you have over 1,400, is it too late?
It is not.
And one of the things to do for the multiphasic, you should not eat for how many hours before?
They tell you 12.
Okay, we're going to be out there, Jim Stallings, and we're going to do our show live from the Morgantown Mall on that Friday.
8:30 to 9 or an hour and a half?
10. 9 to 10 that day, yeah.
Okay, good.
So we hope to see a lot of people come out, which you usually have. It's not a problem getting people out for the health fair.
And we'll be near the food court, but we won't be tempted to
Never
eat anything
No
there.
Snickers for you that day.
All right, we're going to take a break. You're listening to Health Talk, brought to you by Mon General on WHAR.
The doctors, the latest news and procedures. Your local health connection is Mon General's Health Talk. If you'd like to be on the show, call 304-296-0041.
It is Valentine's Day, and of course we're focusing in on the heart today here on Health Talk.
And you think this is by accident?
No.
I mean, we planned this.
Yeah, there's a lot of thought that goes behind this. And we have Dr. Dave Lawrence in the studio this morning, Medical Director of the Mon General Emergency Department, and registered nurse Nancy Ord, director of the emergency department at Mon General Hospital. And I think most of us know that we probably smoke too much, drink too much, eat too much, and these things can lead to heart problems. If we develop some of these symptoms, or we sense we're getting some of these symptoms, should we just drive ourselves to the hospital and go to the emergency room and check ourselves in? Nancy?
I can answer that.
Yes,
Yeah,
go ahead,
I know,
Greg.
that's a loaded question.
Go ahead, Nancy.
Obviously, we should call 911. We shouldn't try to
911.
drive ourselves or have our spouse drive us.
Right, because they can start the care right away. They can do the aspirin. They can do nitroglycerin. If your heart happens to go into that funny rhythm called ventricular fibrillation, they can shock your heart, which those are things, if you're driving yourself, you can't do. So the care actually starts when they get there.
So if we think of the ambulance as being a hospital on wheels and the hospital's coming to our door to take care of us right there, then that's the way to think about it, rather than thinking I can get myself to the hospital quicker than I can an ambulance coming to my house and getting me back to the hospital.
There's more to that as well. Most of the ambulances in the area now can transmit an electrocardiogram to us. With that possibility, if we see the signs of a heart attack on the EKG, we go ahead and prepare the cath lab. So it's a possibility to come in through the emergency department for 1 or 2 minutes to get things stabilized, and then straight to the cardiac cath lab, which is the definitive treatment for most heart attacks.
So by the time we come into the emergency room, we've already had treatment. We've already had a professional looking at our situation, taking the EKG, transmitting it back to the hospital. Somebody at the hospital knows what to expect when we come in the door.
That's correct, and we have all the horses in line to take care of you.
Of course, what we've talked about this morning is probably for women it's going to be a little tougher to recognize than you would for a man, where you're in that state where all at once you're having all this pain, because that's so gradual for women. But, of course, always call 911. We're talking to the women today, but if you're listening, all of us need to know these signs, not just women.
That's correct. And the push currently is to help everybody. And what that means is if you listen to the program today and you recognize some of the signs and symptoms, and you're talking to somebody you know or a stranger and they start telling you that they're having these symptoms, you tell them that this certainly could be a coronary event, and let's call 911 and let's get you to the hospital. That way it's kind of a take care of thy neighbor sort of thing, and it's going to help everybody get into the system faster.
There is something you mentioned earlier in the program that I want to revisit, and that's those people with diabetes. And I know there's a lot of people that are listening to this program that have diabetes or know someone that has diabetes. Could you explain to me how that's related to heart disease and heart attacks?
Wow, you really pulled that one out for me, didn't you?
You have a minute and a half.
Well, no, you have more than that, but I just want to, I think most of us understand the body not producing enough insulin to control the sugars. I'm just wondering, does that make the heart work harder in some way?
It contributes on multiple factors. The one is it actually increases the body's tendency to make plaque and to stiffen arteries. For lack of a better description, the sugar deposits on nerves, vessels, and a little bit of everything. So it's kind of the same thing if you know diabetics that have a hard time feeling their fingers or their toes because the nerves have been affected. The same process is going on inside the arteries throughout the entire body, but the small arteries are in the heart. So they plaque up first, so that's why they're more prone to coronary artery disease.
I even understood that.
Is that similar to the cholesterol plaque, the bad cholesterol that contributes to heart disease?
It is, and people with diabetes also have fat metabolism or lipid metabolism abnormalities, so they're more likely to be high cholesterol, and the ratio of good to bad as well as triglycerides usually tends to be more abnormal the more often your sugar is elevated.
And so if you have your sugars under control, where your doctor says they should be, then that generally should keep those small arteries from getting clogged up and those nerves with sugar.
The better you have your diabetes under control to come as close to a non-diabetic brings your risk factors almost down to the same as a non-diabetic. So when your doctor starts talking about a thing called a hemoglobin A1C, which is a monitor of your blood sugar over about a three-month time period, if you can keep that within normal range, your risk for heart attack goes down almost to the general public.
All right. Tell us again when the health fair is.
February 22nd and 23rd.
So that is next week. All right. So on Friday and Saturday. Friday and Saturday of next
7 to 5,
week.
7 to 3.
At the Morgantown Mall. And we're going to be broadcasting that Friday from 9 till 10 at the food court and giving you all the information you need. We'll see a lot of you there in person because it is very well attended. So feel free to stop by and say hi, yell out to us, even if we're talking on the air.
We don't
mind
take your
that.
blood pressure maybe or something.
Who, you and me?
We could.
Yeah, we could. I mean, I'll bring my cuff. You bring your cuff. That's just off the cuff. And that is Health Talk for today, brought to you by Mon General on the Voice of Morgantown, full service 1440 WHAR.